to talk to you about ACL rehab.
ACL is better known as anterior cruciate ligament.
Oh yeah. ACL injuries are the most common among athletes, especially high acceleration and deceleration sports. For example, basketball. The function of the ACL is to prevent anterior translation of the tibia on a fixed femur. Right there. Oh yeah.
As was mentioned earlier, ACL injuries are quite common among today's athletes. Here we have a prime example of a professional basketball player who accidentally injured his right ACL. This injury isn't career-ending, luckily. So today we're going to be working on some simple functional exercises. The first one here is going to be achieving his proper range of motion. So what we're going to have is we're going to have Jesse, our basketball player, to slide down until his legs are hanging off. So this way, just his kneecaps are off. We just want to be right there. Good job. So since it's his right ACL, we're going to get him to cross his legs by putting his left leg on top of his right leg. And what we're going to get him to do is apply pressure with his left leg in order to force his right leg into extension. Some contraindications of this exercise are if the player is not fully weight bearing or has not achieved full range of motion. This exercise will help achieve full range of motion, especially through stretching of the Achilles and of the hamstrings.
Put me down! Put me down!
Sorry about that, duty calls. You want to come down?
Yes, please.
Okay. Let me know when you're comfortable. You gotta always make sure your patient is comfortable, otherwise it's very stressful on them and for you. How's this, sir?
Much better.
Much better? Okay. So I see you uncross your legs. Can you please cross your left leg onto your right leg again? Good job. So this is what we call a prone extension exercise. And as I said, it stretches your hamstrings and your Achilles and provides a full range of motion in the extension reference. So he's doing phenomenal here. The next exercise we're going to get him to do, would you please flip over onto your back? And we're going to raise your back up here. That's a good one. Yeah. Okay, the next exercise we're going to be doing is working on quadricep function to actually properly engage this extension. We had gravity assisting here, but now gravity is going to be negligible here. We're going to be working against gravity. So I'm going to get you to do you mind if I roll the shorts a bit?
Not at all.
So I'm going to get you to contract your quads while forcing your right knee into the table. There you go. You can see he's fully engaging his quads in order to achieve full extension. Now to properly do this, or do this in a more advanced fashion, would you please raise your leg up off the table using your hip flexors and your quadriceps. Phenomenal. Good job.
So now that our patient is fully weight bearing, we can start with some strength exercises. So what we're going to do is we're going to have to do a wall squat with an exercise ball in between, just to give him some more support. Okay, so yeah. So put the ball against the wall, and now, yeah, turn around, perfect. And now when you're going to come down, and as you're going down, I want to make sure that your patella does not come over top of your toes. So just come down, do a full squat, just almost like you're sitting in a chair. Perfect. And come up, right? And you also want neutral spine, so you want their spine to have the proper curvatures to them throughout the whole motion. Perfect. And then you want them to have to do, for strength exercises, anywhere from 3 sets of 10 to 4 sets of 10, depending on however they feel. How do you feel?
Pretty good.
4 sets of 10 or 3 sets of 10?
2 sets.
Nice. Cool. All right, so now that we've got the basic strength down, we can move to more functional exercise. So we've chosen the lunge, and he's got 2 1-pound weights on either side just to give him that extra amount of resistance. All right, so now what you want to do is go out into a full lunge all the way down. And again, you want to make sure that your patella is not going over top of your toe. Great. It's a very good full range of motion exercise as well. And we're going to do both sides just to make sure that we're equaling out the balances of the exercises. All right. And so some contraindications for this exercise would be overextension of the knee over top of the toes, which could put extra stress onto the ACL, which would ideally not be the best. And same thing, it depends on if the patient is ready for it and if the patient can actually even do the exercise properly as well. So we're going to have Devin here just explain what we're going to have Jesse do here now.
After we've got full functional flexibility and extension, so full range of motion, and he's progressed through his strength training exercises quite nicely, we're going to work on balance, coordination, and agility. And as you see here, we're going to have him working on his balance exercises. So we've got him on here right now is a wobble board. The wobble board is just going to work on his proprioception and increase his balance, which is very important for the knee joint as it's a fairly significant stabilizing joint within the lower body.
And we've added the basketball just as an extra sport-specific kind of progression a little bit to it, just so he gets the use to holding the basketball and as well as doing balance as well. Sorry.
So as we can see here, he's doing phenomenal balancing. So we could even progress him through this as him doing a squat. Now again, just like the wall squat, we want a neutral spine. We want him to go down as low as he can. Again, providing no pain, no other contraindications, and have him come back up again. Very well tested. Very well. After we've done 3 sets of 10 on this, we're going to flip him around, so when he's standing on the other side of the wall. This is just a different balance exercise, but still the same thing. So we can do a squat like this. My grandmother could have done it better.
That was a terrible squat.
For our next exercise, we're going to progress into a Bosu ball. So again, changing up the surface a little bit, making it a little bit more difficult for the patient. So we're just going to have the patient walk up onto the Bosu ball. All right. Now, it's an uneven surface, so he's got to kind of balance that a little bit. And now what I want him to do is, again, do another squat. And, yeah, perfect. And again, it's okay. Okay. And for this exercise, it's all right if their knees do go over top of their toes, just because we've progressed through that series. So now it should be strong enough that he should be able to do that. Awesome. Great. That's good. And to progress it even more, we can have him do a one-legged stance on the Bosu ball. So we're going to have him stand on one leg, and this will help with his balance. And we can also measure his progression through how many touchdowns he does with his other foot. So that'd be 1. You can do it. That's 2. Okay. Yeah, and so for that you can just see how well he gets through that.
For final progression, you can either do perturbations or tossing. The tossing is going to throw his center of gravity off balance, and he's going to have to try and regain his balance through his injured leg. So what we have here, instead of doing perturbations, is the basketball, which he injured himself with. And we're just going to be tossing it to him, and he's going to be catching, and he's going to be tossing it back to us. Right, Jesse? you can see, Jesse's progressed really well throughout his rehab. And next we're going to be getting him on through some functional and sport-specific activities before he returns to play for the Lakers.
Devin. Hi, I'm Todd. Oh, shit. Okay.
I'm sorry, it's just so funny seeing you slowly going up as you're talking. It's so freaking funny. Okay, I gotta stop this.
As was mentioned earlier, ACL injuries are quite common on stage. Gain his range of motion and
Fuck.
gain his range of motion and
Fuck. Oh shit. Sorry.